The health situation in Palestine is critical. In addition to the issues regarding health which are common to every country, here there is a complex political situation, lack of water, restrictions on freedom of movement and loss of hope.
As for the healthcare in Palestine, during the occupation it degraded a lot. After occupation, when the Palestinian authority took over, the case of the hospitals and the government were not excellent. With the Palestinian Authority, they started to develop, but there was a lot of things missing in the equipment, in the formation of the doctors, and high specialties. When we want to do high specialties, we'll go to Jordan or buy service in Israel.
Public health is precarious, and private hospitals are very expensive. In contrast to this difficult situation, solid initiatives such as the one promoted by the Pro Terra Sancta Association of Bethlehem make the difference. For over 10 years, ATS Pro Terra Sancta has been committed to providing concrete answers to those who need to be able to rely on an emergency service, medical care, and to have answers. These are small signals which we try to give in times of need. The institution acts as a bridge between those in need and those who can help. A few years ago, a network of local Christian organizations was established to provide practical responses to emergencies. What does this mean? Those in need turn to us, come to our offices, meet a social worker, then we study the case and contact the hospital. The initiative is funded by the donations from parishes, families, and people sympathetic to the cause. Only in 2018, the Pro Terra Sancta Association received more than 480 help requests for clinical analyses, medical treatments and therapies, 320 of which received a concrete response. We had, for example, a 60-year-old who needed an examination in Israel at the Hadassah hospital, and the cost of this examination was 40,000 shekels, which we were unable to pay for in full. It is true that we offer help, but people keep suffering from the lack of full coverage for large sums. Mrs. Neme is located in St. Anthony's Old Age Center in Bethlehem. She has no relatives or financial resources. The help she received was fundamental. I had a heart surgery and initially received help from the health insurance company, but at some point they stopped giving me the medicine, so I had to seek help elsewhere. The Arabic Society is one of the hospitals where the Pro Terra Sancta Association sends patients.
We never refuse a patient who has no money. He goes to the social department, a report is done, we contact other NGOs in Palestine who can help, and together we can help the patient. Sometimes we fail to get funds, but still we do it because the employees of BSR, even the doctors who work on percentage, they don't take a percentage. We are all one team. We work towards an objective. Healthcare is the basic of human rights for every person. And this is the basic of democracy.
2 settimane fa è stato veramente una settimana piena che abbiamo scelto.
Some time ago we had a busy week. We chose 7 people to undergo major surgery who didn't have to pay for anything because the surgery was paid for by the hospital and by many volunteer doctors from Great Britain and other countries.
È stato offerto dall'ospedale e anche di tanti dottori volontariati che sono venuti dalla Gran Bretagna e di tanti posti.
Examples of solidarity and union in a land where there is so much division. Real cases in which it is possible to affirm that every patient is, first of all, a human being.